if I live in a city where the EQI is high, I should be screening for lung cancer like a smoker? Is that what you're saying?
Yes.
How do we then build activity into our lifestyles when we live in cities that are so unfriendly? Are we overusing antibiotics in India?
I think all over the world, not just in India, why are people talking about sleep? So, the only time that your body repairs itself is when you sleep. The amount of time we spend with our mobile phones is giving rise to a lot of muscles, bones, and tendon related issues. Because the longer you stay in the hospital, more chances of you developing, catching superbugs and getting more ill. A cake sitting in a nice pastry shop does not make anybody fat. Right? It is our behavior towards that particular cake that leads to problems in us. Smoking is the most underrated pandemic which the younger generations and the older generations together, especially after COVID, are facing, but nobody's talking about it.
What is your opinion on alcohol consumption?
Okay, मुझे शायरियाँ याद आ गई अपनी सारी।
सुना लीजिए।
नशा शराब में होती तो झूमती बोतल।
Dr. Thakur, thank you so much for speaking with me. You are Director, Internal Medicine, Acute Medicine, Clinical Transformation, and a specialist at Lifestyle Medicine and Longevity. I have so many questions simply from your designation. What is lifestyle medicine?
So, lifestyle medicine is what has come, or I would say probably the beginnings of this can be traced in from 1980s. The earlier Joint National Committee report, the first one, which was published for hypertension, actually, and diabetes, mentions lifestyle medicine. So essentially, all the metabolic syndromes like high blood pressure, diabetes, obesity, and diseases related to them, insulin, sensitivity or lack of it, all of this together is termed as lifestyle-induced diseases. So we have one thing where we get infection and infection-induced diseases. The other is where, because of our poor lifestyle, we get these diseases. So in simple terms, if the cause is lifestyle, then the treatment
solution should also be
lifestyle. But we have overlooked this over a long period of time. And we have gone towards, innovating and creating new drugs. Quite rightly so, because they're effective, but not as effective as dealing with the lifestyle issues.
So is this different from your doctor saying, you'll have to, stay away from, junk food and eat healthy and walk a little bit? Is that lifestyle medicine?
So part of it, yes, but one has to understand. So I keep saying English is not my first language. Okay. So, and we try to converse in English, hoping that we will understand exactly what we are saying. Lifestyle is everything that you do, and if I can explain it in simple terms, from the time you get up in the morning till the time you go to bed and again. So your entire day's routine, and that includes, you going to work, not going to work, meeting friends, socializing, everything. So everything that you do as a part of living is your lifestyle. So when you talk of lifestyle medicine, you're talking of actually making small little alterations in literally every second of your life.
Give me an example. Let's say there's someone with type 2 diabetes who has come to you, and the type 2 diabetes is likely to put them at risk for a bunch of other things.
Absolutely.
What are the lifestyle prescription you will give them?
So one simple thing I keep telling people is that if you got type 2 diabetes, mostly it is because that you're producing decent amount of insulin, but that insulin is not effective on your certain parts of your body, like the liver or the fat tissues and the muscles. Now, essentially, we have got enough research which says that literally if you move your body a little bit, it will start consuming more sugar and it will start making you sensitive to insulin. The fact that we don't move, and we don't move for various reasons. It might be work. So somebody might be sitting for 8 to 9 hours on a chair and doing their work. Others might not get opportunity to go for a walk. And we might not stretch in between. And we might think that this is all part of, our life. If you change that and fill it with activity, and by activity, I mean literally, if I sit here and move my muscles like this, I'm helping my body get rid of, the problem of insulin sensitivity. So it's that simple. So moving is very important for anybody who's got type 2 diabetes. The more you move, and then there are different types of movement. We call it something where you can carry your own body's weight, functional movements. You carry other weights, which is basically helps you in training your muscles. And then something which can help your heart as well. So the aerobics. It also combines yoga, or yoga as we call it. So simply sitting at one place and doing pranayama can help you move everything right from your belly to your brains. So the entire blood circulation improves. So all that movement, whether you are sitting at one place, swimming, or literally standing, while you're doing your work and moving around, is going to help that person with type 2 diabetes.
Yes.
Oftentimes, I get people coming to me saying that, I've got this particular work-life schedule and I have no time to go to gym or aerobics or anything. And I say, yes, you're right. We have to step away from thinking that, going to gym after sitting for 8 hours, 10 hours, or 12 hours is going to fix this. It will never fix it. Take my word. What we need is that we need to modify the way we work. A lot of sphere of work is already going on in terms of ergonomics. How do we sit? How do we walk? If we are standing, can we move? And there are lot many things that you can do, even while you are sitting or standing, which will allow us to fill in that void where we keep saying that, we cannot actually...
You can compartmentalize what you do for the whole day with your wellness and your exercise and say, okay, I will have this 1 hour at the end of the day in which I will do it. Yeah. And for the rest of the day, I'm going to be completely sedentary.
Absolutely. That's not going to work. And it's not going to work because our human brain oftentimes tries to think in a way where a perceived act which is given on top of what you're doing normally is a chore. You do not want to do an extra chore, right? So what you want is something that comes easy.
Yeah.
So we were very good when we were farming, we were hunting and gathering.
Yes. That brings me to my next question. And every time, every time one of us from India travels overseas and you're sightseeing or you're just visiting another city, you wind up walking 15,000 steps a day.
True.
Because all of the big cities in the world outside of India, whether it is Singapore, Paris, New York, all of them, London, they encourage people to use public transport.
Yes.
And you're walking from point A to point B.
Absolutely.
And the footpaths are usable. Yes. The streets can be crossed. There's a lot of user-friendliness that gets built into our cities. But in India, it's really difficult to do that kind of walking. A lot of people then just use their cars.
True.
We don't use public transport as much as we should. Our footpaths are unsafe. So, for example, I would tell my parents not to walk on the footpath because it's so unsafe.
I agree.
Because there's a likelihood of tripping and falling and hurting themselves that much more. How do we then build activity into our lifestyles when we live in cities that are so unfriendly?
So, again, I think this is something that has to be thought at a much a bigger stage. But the question that you have raised is very pertinent. One has to think of this because the burden of the lifestyle diseases is just begin to show up.
Yes, and it'll fall on the same government that is not paying attention to these things to begin with.
Yes. So I think not just the government, but we all have a role to play in this, right? One is awareness, which you are trying to do here. And definitely the civic bodies will have to look into it because ultimately the cost of lifestyle illnesses is something that, all the institutions will have to pay in the longer run. Okay. So I do not even want to go into the healthcare economics, but essentially it's simple. So what can we do as individuals to deal with this while our cities are grappling with space issues and stuff? So I think one of the simple things that we can do is, and which is again very little practiced is yoga, or yoga as they call it. It does not require a lot of space. You can do it, anywhere you can find a little bit of open air, or even if you don't find that. And all the asanas and pranayams are as much effective, or, if not more, than anything else that you would do while you're outside. And if we combine that with bit of aerobics, weight trainings, then we've got the full, 360-degree effect. And trying to do that away from work is going to be a challenge. So I think what most bigger industries and others need to start thinking is that how can we build that into our, as you said, can we have, like in the last workplace that I had, we built in small markers on, the pavements or places inside the hospitals, where it said that if you start from here and reach here, you've done 300 steps, or you've completed 1,000 steps, so something like that, where we can encourage people to use more stairs, where we can encourage people to not sit for, long hours, but have desks and chairs which are more ergonomically friendly for our body, which is working against gravity at all times. So it's really key that we look at it,
When we talk about lifestyle and longevity, especially in India right now, we could do everything right. But if our AQI is at 450, which is where it is, sustained in many parts of North India right now, and it will stay that way for several months. In Mumbai today, while we speak, we're at 250, which is not good. How badly will that affect the average citizen if we're living with AQI of 450?
So it's no rocket science. Anything which is detrimental to your lungs, air which is not breathable, is going to affect slowly, causing inflammations inside your blood vessels, and the same kind of effect that you see with the lifestyle illnesses you will see. So ultimately, it is inflammations caused by these particles, starting from your lungs, then going into your systems, and then driving the same inflammatory changes, which we call as metabolic inflammatory syndrome. So you'd see the same effect. So yes, we know that very well. The effect of smoking is very well studied. So the effects are not going to be any dissimilar. And what we need to do is think of this as something which is a problem here and now. So, while wearing masks and trying to avoid crowded places are the simple ways of dealing with it for somebody who's already suffering. But at a larger scale, I think it's a question that every citizen should ask themselves, that, what sort of cities do we want to live in?
We also had a problem with a superbug. Lancet said India has become a hub for superbugs and for antibiotic-resistant bugs. What does that mean?
So a superbug is nothing but a normal bug which has had sensitizations over a period of time with multiple antibiotics that we have, against them. And now they have slowly developed resistance to all of them. So that then becomes a problem, because if it is then a part of an immunocompromised patient in a hospital or anywhere else, there is no single antibiotic that you can use to fight the superbug. So it is, again, just like lifestyle. This is something which is better prevented than cured.
Are we overusing antibiotics in India?
I think all over the world, not just in India,
we
have the problem of, judicious use of antibiotic. And we have to refrain. And again, it's multifactorial, because sometimes it is not just the physicians or the clinicians who wants to use it, but it is, sometimes patients or families or people who are not very well educated. Over-the-counter drugs and antibiotics also plays a role in that. But yes, one of the key messages that I would give is that you can avoid or you can reduce the incidences of superbugs by reducing the time spent in hospitals, because superbugs don't grow in communities. Superbugs grow in hospitals. So the lesser you stay in hospital, the lesser chances of you developing a superbug or the superbugs developing themselves.
How does one stay out of hospitals? Well, I mean, sure, everybody would want to. It's expensive. It's unpleasant.
Yes.
No offense to any of the doctors who are listening, but how does one stay out of hospital?
So very simple. First, do not get ill. Follow the lifestyle interventions and changes that I've mentioned. But most importantly, I think if we
No, but hang on, sorry. Lifestyle interventions and changes. You mentioned movement a lot. You said nothing about diet.
Yes. So movement is one of the key things. Diet, again. So I'll tell you the crux of everything. Movement, diet, sleep, all together, while we can talk, for hours about all of them. But the underlying root cause for all of this, and I keep saying this to everyone, is human behavior. Okay. Now we talk a lot about what diet we should eat and what we should not eat. This food is fattening. This food is not fattening. This kind of an exercise is healthy. This is not healthy. But ultimately, who is the person who is doing that? We forget that there is a human being who has got a right to choice.
Yes.
Today, I will choose it because I have a wedding, or I have multiple reasons. But tomorrow, those reasons will not exist. And therefore, I will go away from it. So what is it that is driving these choices? It's our own behavior. So until and unless, and I've kept saying this for eons now, for years and years, that while we are dealing with lifestyle issues, we have to focus on behaviors, our own behaviors. Of a cake sitting in a in a nice pastry shop does not make anybody fat. Right? It is our behavior towards that particular cake that leads to problems in us. So I think if we can try and work on our own behaviors, and there are ways and interventions which we can teach people in order to do that. And that gives lasting changes.
So activity, diet. I mean, we now have, wearable tech that's measuring sleep.
Yes.
And so people are telling us that sleep is really important.
Very important.
And I find this fascinating because nobody has told us this as Indians ever. Because I remember when I started my career, I would have bosses who would tell me, no one has ever died of hard work. Apparently, people have. And, not sleeping and working through the night and, not caring about how many hours of sleep you get actually is deeply detrimental. And we have a very counter culture to sleep in India. It's considered lazy. You're not, if you don't work these many hours per week, and if you're sleeping in and you're not up at the crack of dawn and you're not, burning the midnight oil, you're considered a lazy person in this country. Are you telling us that all of that conditioning is wrong?
So, English is a very funny language.
तो हिंदी में बोल दीजिए फिर.
हिंदी में बोलते हैं. देखिए, जब हम ये कहते हैं कि सोना खराब है या कम सोना is considered lazy, वो गलत है. Hard work is hard work. ठीक है. And I think we're trying to mix two concepts over here. And I'll try to sort of, separate them. So, whenever one is working towards a goal or a dream or something in a short burst, done at a particular time, when your body is able to recover. So, one has to understand, आपको ये समझना होगा कि नींद का मतलब क्यों था? Why are people talking about sleep? So, the only time that your body repairs itself is when you sleep. That's the fundamental theory. One has to understand this. And our body needs constant repair. अब इमेजिन करिए कि इस बिल्डिंग को रिपेयर की जरूरत है और हम सब इसमें काम कर रहे हैं, हम ब्रेक ही नहीं ले रहे हैं, हम ये बिल्डिंग खाली ही नहीं कर रहे हैं, आप कैसे रिपेयर करोगे? राइट नाउ सेम थिंग गोज फॉर स्लीप. जब आप सो रहे हो और बॉडी रिपेयर हो रही है, आपकी एबिलिटी व्हेन यू आर यंग टू रिपेयर इज वेरी वेरी डिफरेंट देन व्हेन यू ग्रो ओल्डर. सो यू गेट लेस स्लीप, but your body is able to repair and recover within that time. The same does not apply when you are 30 years. So what was it? 16 years changes because the time to recover and repair has changed. So if you sleep for the same amount of time, half of the repair is undone.
Okay.
So now it's causing problem, which it didn't cause when you were young. And when you grow further older, again, the time taken for repair increases. So it's a simple way of understanding that why sleep is important and how it is different from just hard work. Now, if you do not sleep for more than 6 and up to 7 hours, because sleeping longer also is not healthy, then your body's ability to optimally repair itself and rejuvenate so that it is ready to face the world again tomorrow is hampered. And, one of the worst punishments that, quote unquote, people used to give in certain confined areas was lack of sleep. So you deprive somebody of sleep deprivation, because your mind cannot function properly because it needs sleep in order to repair. So yes, sleeping is important. It is slightly different when you are young, but as you grow older with age, it becomes even more important, because that's the time when the body repairs itself. So we have to give enough time to our body to repair and feel rejuvenated.
I was going to ask you about stress and anxiety.
Yes.
Which has become such a large and a real part of our lives. We perhaps didn't have the vocabulary for it until recently. We now know what it is. Let's assume there's an individual in their 30s who is doing everything else on your checklist: the activity, the mindful eating, the sleeping. But if there's a lot of stress and anxiety, does that undo everything else?
It does. It does. Because remember, our entire body is run by a tiny little thing, the brain. Not so tiny, but essentially that. And it is essentially the powerhouse. It determines as to how the entire body will function. So anxiety and stress over a longer period of time causes detrimental effects in the body. In the short period of time, it is actually very productive, because it keeps us awake, alert, and motivated, and you want to go and go get it. But the same thing, when applied over a longer period of time, causes wear and tear, inability to repair completely, and therefore you see the damages. So one has to understand, and in fact, I'm so glad you raised that topic. What we are seeing increasingly because of the raised level of anxiety is smoking. So I keep saying that smoking is the most underrated pandemic, which the younger generations and the older generations together, especially after COVID, are facing, but nobody's talking about it. Okay? So literally everybody is now smoking, either smoking or vaping. And it is one of the simplest way of getting away from that so-called of an burst of anxiety. And again, together with smoking and anxiety, it's the worst combination that you can give. Your body gets inflamed like there is no tomorrow, and then you will have to pay the price with, inflamed blood vessels, organs down the drain. So how should one deal with anxiety? I think one has to again address the cause of it. What is the real cause? One has to understand. And in my patients, I keep asking them, what is the one fear that human being has, which is worse than any fear that you can think of? Do you want to take a guess?
It's fear of failing, fear of dying.
It's fear of the unknown.
Right.
So when we do not know what it is, how it is, who it is, what to do, that creates an anxiety in our minds, which is worse than anything else. So I keep telling people that, like a small maze, you have to just sit and understand what is it that your mind says that you don't know, and how can you go from the unknown to the known. So if you do that exercise, most of the times, you would be able to at least find out the root cause and start working on it. Leaving it alone is the worst thing one can do. So one has to start, and the starting point is to just write down, what are all the things that's bothering me? And what is it that I don't know? Because once you know, you start working towards it. The younger generations, the generations of today are very empowered. They can work a problem. But what they can't work is what they don't know. In relationships, if I don't know, I'm worried. Okay? Financially, if I don't know, I'm worried. Job, what will happen tomorrow, I don't know, I'm worried. So if we can go from the unknown to the known and do that exercise for our own self, I think that'll be a very good starting point.
Let me ask you this though, as a lifestyle physician, would you recommend a GLP-1 to someone who needed to lose weight, who's not diabetic?
So interestingly, when GLP-1 was being studied, I was in UK, and we were increasingly studying this hormone, incretin. And, all the scientists and scientific community would come together at that particular time, trying to ask questions that what all ill effects can it cause, and is it a good thing to do or not. So I know this for many years, even before it actually came out as a drug which has been approved. And I can tell you this, that it is one of the very nice disease modifying drugs. So far we had what we call as a disease stabilizing or containing drugs in diabetes. We didn't have a disease modifying drug, which basically, modifies the whole root cause of the disease as such. And as I said, it is our behavior towards food that makes us,
Yes.
it is our behavior towards exercise, it is our behavior towards sleep. But here is basically a small little molecule or hormone, which basically makes you feel hungry. And you deal with it, and, all of a sudden, you're not feeling hungry anymore. And it allows people to modify that behavior. So it's a very good adjunct to behavior modification. And it has shown its results, very positively across. What I would caution a little bit, though, is that one has to understand that we are taking this, from external sources. We are not creating this ourselves.
Yes.
So you're dependent upon something. What will help people more is that if they develop that willpower and they initially lose weight or modify their habits and behavior and show that, they're progressively going towards that goal. And in numbers, it is, 5% of weight loss is what we say. And once you're able to demonstrate that and then take this, then yes, it has got a very good effect. And of course, the side effect profile in terms of people who have got issues with liver and other things, one has to watch for. But yes, it is a good drug and well proven, very expensive at present. So I think one would, keenly await better alternatives which are more economically available across the world. But what I would also caution is that let's not stop this from changing our behavior towards our lifestyle. Because there are things which we can do which will look after us or which will make changes from the root cause point of view, holistically. And that is something which I would still encourage people to sort of focus on, because that would give lasting impact, more peaceful and more what we call as a, mindful self.
What is your opinion on alcohol consumption?
ओके मुझे शायरियाँ याद आ गई अपनी सारी
सुना लीजिए।
नशा शराब में होती तो झूमती बोतल तो शायर तो वही कहते हैं so see, alcohol as well as cigarettes in fact it's fascinating, if we just rewind 125 years ago, and if you and I are sitting today in New York or London and having a discussion, you might have a cigarette in your hand and we might have an ashtray over here and we might be smoking on the show.
Yes.
Okay. It was almost 100 years ago, it was a prescription drug.
Yes. During the First World War, they handed out cigarettes.
Yes, both alcohol and cigarette was prescription drugs. We were prescribing it to people. So, and of course we have learned. So we've come from there today, understanding that a cigarette 100% is bad for you. Even 1 or 2 cigarettes a day is bad for you. No doubt about that. Okay. Alcohol, I think we've been going up and down about, whether it is good, whether it is bad. See, it all boils down to, again, the human behavior and how it is being influenced. So when you consume alcohol, it basically, and we say that we have to consume it in moderation. If you can do that, and there are moderation limits defined. As a man, it's different. As a woman, it's different, the way we metabolize alcohol. But if you can do that, that's fantastic. My observation, though, is that we tend not to. And let's call a spade, So we tend not to do that. And that's where the problem begins. And everybody who drinks alcohol knows this. That's even more intriguing that, binging is a big problem. So, we say that we don't drink, we drink only once a week. But if you sort of, open
but if
up
you
the lids,
binge in that one
it's very dangerous.
It's dangerous.
Yes, binging is more dangerous than having actually just one drink, which is below the limit almost for, entire week. But the trouble is that the first thing that the drink does, it slowly just takes away the social inhibition. So our human brains have got a switch, which is called as a social inhibition switch in simple layman's term. That's the reason that we are dressed here, we're nice and sober, sitting, talking to each other. The beauty about alcohol is that it just goes slowly and turns that switch off.
Mm.
And once the switch is off, somebody comes in and says, hey, have another one. You are not competent cortically, which means that your rational thinking brain has gone to sleep. So it cannot rational anymore. And therefore, you are then prone to, binging or taking extra drinks. So one has to understand this before making a decision that I should have only one or I should have more than one.
What are the earliest clues that the human body will give to suggest that there's something wrong, that something needs looking into? Or, because you normally wait until the whole thing collapses before we go see a physician. What clues should we look for?
So I think so there are, it's a very broad question. So I try to try to make it into different buckets. So one I would say is that your habits. So if you've developed a habit, whether you're sleeping less, you're not exercising, you're smoking and drinking alcohol, I think you don't need to wait for any blood test to go on abnormal. You need to go and seek help. And I think we've done very well in coming forward and talking about mental illnesses, anxiety, depressions and stuff. We've done a great job. And I think we should congratulate everybody in India for that. But what we are not doing, and the youngsters, if they're listening to this, must do, is that understand that if they're smoking too much, if they're drinking too much alcohol, if they're anxious and depressed at the same time, they really need to seek help. Okay? Smoking is not good. Drinking is not good. And that, along with anxiety and stress, is even worse. You don't need to wait for your body to tell you that, you need to go and seek help. So seek help now. And we need to develop centers where these people can go and openly seek help without, having the fear to be blamed. So that's really important. The second part comes is that, if you are a fit and healthy person, do not have any of these, habits, then you need to be doing certain sort of preventive tests at regular intervals, because there are certain illnesses which will not give you a symptom like a headache or a body ache or, things like that. So while I see in the Western world that 40 is probably the age when people start looking at doing these tests, I find that in India, and by test I mean checking your blood pressure, you'd find it amazingly underrated that how many people have high blood pressure in their late 20s and early 30s, which they do not know, and they never get checked. And just that simple check could prevent them from developing a bleeding in the brain and a paralysis. So one needs to do at least simple observations and checks. And I would suggest that should happen as early as 30 years, not waiting to 40 years. Then comes the symptoms. So if your body hurts anywhere, it's basically a sign that you need to, sort of go and seek advice or help. And people often, I've seen this here much more than anywhere in the world, that they say that I'll live through the pain, it'll make me stronger. I just can't understand that. I'm like, wow, okay, never heard that. So I think, one of the key things is that one needs to understand that, if you got pain, if you see something which is out of ordinary, seek help, because those are the body's way of telling you that things are not working.
Icing it and taking a painkiller and then just moving on is a bad idea.
If the painkiller does the job, and if you know that it is just your routine aches and pains, but if it keeps recurring, then definitely seek help.
Do Indian hospitals over-test for commercials? Do we over-test as a country? Is that a bad thing?
I think we are skewed.
There are two different Indias.
Yes. Yeah. So I think we are skewed. I would love certain people to do certain tests, and I'd find that either they are not financially capable or not aware So that's been the story. 25 years ago, when I was practicing in rural India as a part of my medical training, I had extreme difficulty in trying to get a small boy from his community who were living up in the hills, like in the tribal area, to come and seek medical help. And unfortunately, that still exists. So we have one, and that community is probably the biggest community which do not get adequately tested. We do not have standardized testings as well, which basically allows people to understand what the diseases are. And on the other side, we have, a lot of people who themselves want to get tests. But what we need is something like an institution which we have in the UK, the NICE, National Institution of Clinical Excellence, which basically tells right from every disease and every symptom as to what is the adequate number of tests, what investigation should be done as a bare minimum.
Yeah. So you did say, of course, that you'd want people to get tested, preventive testing on a regular basis.
Yes.
Let's say for a 25-year-old onwards, how often should they be testing? What should they be testing?
If you are 25 years old and you are generally fit and healthy, then just simple routine test. You do your observations, your laboratory reports. I have seen people having thyroid issues, which is very frequent. I've come across. So testing for thyroid, simple kidney functions and the liver functions, just to understand what is your baseline. Definitely check your blood pressure. Okay. If you've got a family history of diabetes, I see a lot of people doing fasting and postprandial. Let's move away from that.
Okay.
Yes. What you need to do is an HbA1c, which basically tells you whether you have got diabetes, pre-diabetes, or you're not diabetic. One simple test, rather than all these batteries of fasting and postprandial should suffice. So I think these simple tests, along with, a regular check of blood pressure, I find youngsters nowadays developing issues with gadgets. So the amount of time we spend with our mobile phones is giving rise to a lot of muscles, bones, and tendon related issues.
Okay.
Yes. So imagine if you are, just holding your hand up like this, and
All
if I
day.
ask you to hold it for like 5 minutes, you would feel the pain. If I ask you to hold your hand upright with a phone, which weighs 500 grams to 600 grams nowadays, half a kilo or more, what would that do to the tendons, the muscles, the joints?
Yeah.
And you do that for 4 hours, 6 hours, and 8 hours. People hunch and look at the computer screen for 8, 9 hours a day. And all of this is causing, problems. So I think that it is really important for the youngsters to look at that, understand that, these might cause issues in the long run with bones, joints as well. So worth thinking about that when you are at that particular age.
And at what point should we be doing cancer screening, preventive cancer screening?
So preventive cancer screening is something which one should think of from their family history. One key factor is that if anybody has got a particular type of cancer in the particular family, then depending upon that, it basically says it can be as early as, early 20s. So in certain cases of breast cancers, or, starting from the age of 50. So it is very specific to the type of cancers. But as a rule of thumb, anybody over the age of 40 should start screening for various types of cancers. One needs to stay away from sort of blanket approach in these kind of things. You highlighted AQI. Okay. So if you are living in cities where the AQIs are very high, then think of cancers related to that and start thinking of screening early. If
I live in a city where the AQI is high, I should be screening for lung cancer like a smoker? Is that what you're saying?
Yes. If you are persistently exposed to high AQI, then your risk of developing cancers, start getting higher multifold. So one has to take that into account and start screening for cancers related to high AQI.
Gosh. I mean, of course, there are all the other wonderful things in our lives, like polluted water, pesticides, microplastics. So, what are we not screening for then?
So this is why I say that, screening is finding out what's wrong with me, and then treating is secondary care. What I want people to come back to is prevention. Prevention, 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 prevention. If we can prevent all of these from happening, then we don't need to worry about the next steps, which are more expensive, time consuming, and it's a burden to our own selves, our family, and the society. So all those things that you talked about, the microplastics, the pesticides in the foods, can we do something about preventing that from going into our systems? So that's the approach, and that's the mindset and the behavior I would like each and every person in this country to adopt.
When we talk about food, I mean, we've had a very interesting journey with food as a human race. At one point, they said, it's the fats that's making you sick. Now we're told it's the sugars that's making us sick. Now we're told to focus a lot on consuming protein, which as Indians, given our diet, it tends to be really difficult to do. Which school of thought do you come from? Do you believe that it doesn't matter as long as you get a little bit of everything and your total calorie intake is lower? Because I know that that's one group of thought. Or do you actually believe that we need to be focusing on the protein, avoiding the sugars?
So that's a very, very interesting question. So essentially, the way I look at food and tell people is that food is fuel. Let's just make it simple, okay? And let's start with this analogy. Food is fuel. What quality of fuel would you want in your car?
The best kind.
Right? So let's define best. If you fill your car with fuel when it is already full, what will it do? Overflow.
Yes.
Unfortunately, human stomach is made up of leather or muscles, essentially. And it doesn't overflow that way. It expands, and then it basically stores everything as adipose tissue or fat. So that's a difficulty. But one needs to understand these two key principles. One, food is fuel. You want the best quality of fuel inside you. And two, when full, there is no need to actually overfill it. So these are the two guiding principles. Now let's talk about what is good quality fuel or good quality food. Good quality food is a good old days, which was taught in all the textbooks, and I think they did a good job, is a balanced regional diet. Okay? And we all evolved like that. One of the examples I keep telling people is that the studies found that you should lower the salts in your food to, make sure that hypertension doesn't cause any problems. But imagine living in the tropical climate. You sweat. When our ancestors who were living over here, they sweat, they're losing salt along with water.
Yeah.
Now, how would you survive that?
If you don't replace.
If you don't replace it with salt. So you need to have a balanced diet, but you also need to understand how much calorie does the body require to burn, and burn it. Burning it is the most important thing. If you just keep accumulating it and not burning it, it's a simple mathematics. So it's going to cause problems. So yes, a simple balanced diet where you have your enough carbs, enough proteins, and enough fat is really important to understand. What also is important to understand is what are the sources of these foods. So one of the key things which you highlighted is pesticides and other things. We oftentimes, go towards more processed food because we can name the sources. We know where they're coming from. And we are going away from the natural ones because we don't know what is being used there. But one needs to really understand that if we know the source of the food, if we know that, the carbs that we are eating are good, then there is no need to worry. And there is a lot of replacement of what I could term as the near zero calorie food, which we are not looking at. So say, for example, your fresh fruits and vegetables, okay? They fill your tummy, they make you feel full, but they're near zero calories. They provide you fructose or, most simplest kind of sugar, not the complex starch, which is very difficult to break down and then, causes problems. So if we tend to look at our food in terms of having more fresh, more green, a mix of near zero calorie food along with the other simple sources of proteins, I think we should be fine, unless you have a particular condition.
Senior citizens or people, roughly in the age bracket of 60 tend to have more than one comorbidity, as it's called in the medical fraternity, which is someone will have high blood pressure, they will also have type 2 diabetes, or they might have a thyroid condition. So they're constantly taking different medications. What is the best way to manage that situation? Is it important to have one doctor who knows everything about you because he needs to know everything that he or she needs to know, everything that you're taking? Or, a lot of times you have different doctors who are looking at different things. You're developing different conditions, so you need to see different people. What would you recommend? How is the best way to handle those types of situations?
It's an excellent question. I think a question that now we're becoming more and more health aware.
Yes.
And we are trying to treat each and every illness. One needs to understand. So let me first talk about the problems. So polypharmacy is very well studied, and it's very well known that polypharmacy is an independent risk factor of morbidity and mortality. By which I mean that just for the sheer fact that you're taking a number of medications, especially when you are at a certain age, the elderly population, then you are at risk of developing illnesses, more episodes of going to the hospital, and mortality. So it's an independent risk factor. So that's the problem. Okay. Now, how do we deal with the problem? Which is what you're trying to ask. So ideally, if you have, say, for example, 5 different specialists looking at you, each one of them should be reviewing all of your medications at all times and be able to tell you.
How often is at all times? I'm sorry.
Whenever, say, for example, you're seeing them, because that's when they change the drugs or add in or subtract. So at that particular time, they should review all of these medications. And they should be in a position to say that this is going to interact with your other system, and therefore I will not prescribe you this. By which they can reduce the number of medications that they prescribe. Unfortunately, in the real world, that doesn't happen. So that's where you need specialists like ourselves who basically integrate and know all the organs. So we can tell you that, okay, these are the illnesses you have, but this is the minimum medications that you should be taking in order to deal with everything that you have. So that's the ideal situation. And the less is better is the key message.
That's fascinating. Okay, so answer this question. What is more harmful to our health right now, consuming alcohol or consuming advice from social media health influencers?
Oh my God. Okay. I think one has to understand. So again, I'll start with this thing which we're discussing about competency. Okay. So one needs to be competent in order to be an expert or called as an expert who can give an advice. And competency is very well defined. One can Google it and understand. And an expert is also very well defined. One can Google it and understand. And I think when you are looking for advice, search for these 2 things. Is that person an expert? And is he competent? If you find that it fulfills these 2 criteria, then perhaps you might go ahead and, take that advice.
I find it really interesting that a lot of these people who give advice on social media, on Instagram, for example, a lot of their advice is anecdotal, which is, hey, I had this problem and I decided to eat only, grilled meats and nothing else, and all my problems disappeared. And the dangerous part of that advice is to assume that your body is exactly the same.
Yes.
And for whatever reason, what supposedly has worked for this person, and there's no way to verify that, might also work for you.
Yeah. And again, it brings me back to the old English proverb that, a lie will travel across half of the world while truth is still tying his shoelace. So one has to be aware of it. It's fascinating, why do I go anywhere? My own mom, for example, and she would be influenced very easily by what she watches on a social media. Whereas, my advice would probably not be as important.
There's 12 fellowships all over the world, and she's like, I saw it on Facebook.
Exactly. Yes. So, and by this, I'm trying to acknowledge the problem that you're highlighting. And it is a problem. And I think the reason I said that we should have a single source of truth as a country, if we are investing, we need to also invest in terms of healthcare in identifying, curating a single source of truth. And this should be a continuous exercise. And all the experts in the country, we don't have dearth of experts, in the country, and one should do that. And then mass awareness is really important.
I think we have a huge, we haven't brought it up yet, but we have a huge issue with screen time for seniors and the amount of time they're spending.
Thanks for bringing that out. My mom, if she is listening.
I mean, I have the same problem.
Yes.
Like, I'm a journalist and my mother will constantly be reading fake news on Facebook. And she'll call me and say, has this... Mrs. Thakur को समझ में आएंगी तो उनके घर पे कि आप जो सोशल मीडिया पे देख रहे हैं, प्लीज बी वेरी केयरफुल.
एब्सोल्युटली. ये जो और पावर करप्ट्स, एब्सोल्यूट पावर करप्ट्स, एब्सोल्युटली.
यस.
सोशल मीडिया एक बहुत पावरफुल टूल है
जी,
और इसका इस्तेमाल बहुत बहुत अच्छी चीज़ों में भी हो रहा है, बट इसके जो नुकसान है वो भी बहुत ज़्यादा है. और हम सोशल मीडिया को ब्लेम करने से पहले आई एम साइंटिस्ट एंड आई गो टू द रूट कॉज. मैं रूट कॉज पे जाना चाहूँ. सोशल मीडिया पे बातें करता कौन है? इंसान
जी,
आपके मेरी तरह. ठीक है, उनकी जो मानसिकता है उनको समझने की जरूरत है हमें कि हम ये कर क्यों रहे हैं. व्हाई आर वी डूइंग दिस एंड व्हाट आर वी गेनिंग आउट ऑफ दिस. एंड आई थिंक वन शुड आस्क द क्वेश्चन कि क्या आप यही चीज अपने घर के सदस्यों को और अपने परिवार वालों को देना चाहोगे या करना चाहोगे? वी कॉल इट अ फ्रेंड एंड फैमिली टेस्ट इन द यूके कि would you be able to do that for your friends and families? And if yes, only then advise to anybody else. Otherwise, nahi.
Actually, I find it very interesting, and this is, as a content creator or as a journalist myself, कि अगर कोई घर पे टीवी देख रहे हैं और वो एडवर्टाइजमेंट देख रहे हैं, तो एडवर्टाइजमेंट आपको मालूम है कि ये एड है कि किसी ने पैसे दिया, वो so you're not so willing to believe it. आपको इसे सच होगा कि नहीं होगा, ये लोग एडवर्टाइजमेंट चला रहे हैं. बट वही चीज जब आप सोशल मीडिया पे देख रहे हो कि कोई प्यारी सी लड़की बोल रही है कि ये मैंने यूज किया और मेरे सारे एक्ने क्लियर हो गया, यू आर फार मोर विलिंग टू बिलीव दिस. बट एज इंडिविजुअल्स वी डोंट रियलाइज दैट इज ऑल्सो एन एडवर्टाइजमेंट.
एब्सोल्युटली.
और हर एक इंडिविजुअल जो आपके फेसबुक पे, आपके इंस्टाग्राम पे जो कंटेंट डाल रहे हैं, वो एक बिजनेस चला रहे हैं.
बिजनेस चला है.
इट इज अ बिजनेस. वो मार्केटिंग टूल है. इट्स अ बिजनेस. इट्स अ मार्केटिंग टूल. एवरीबडी इज डूइंग इट एज अ बिजनेस. कोई आपकी भला के लिए नहीं कर रहा है.
Exactly. वो अपने वाले के लिए कर रहा है.
अपने वाले के लिए. So we have to be able to, and for some reason, I believe that as we change the way we consume content, so when you're watching in a theater with 300 other people, your mind is different.
True.
When you're watching on TV with your whole family, your mind is different. But when you're watching on your phone, it's weirdly personal.
It is.
So you drop all your guards and you're more willing to believe what you watch.
Yes.
Because it feels like a personal conversation with that person on your little screen. And then that person will tell you something, you'll be like, and then you wind up following, you wind up wanting things that you don't really need and buying things you don't need and then following advice. And a lot of it in India tends to be Ayurvedic advice. Now, here's the problem with Ayurvedic advice is that you don't really know. Haldi is like universal solution for everything. So I want to understand from you as someone who practices lifestyle medicine, where do what is your point of view on Ayurvedic treatment and how should, if at all, should one access that treatment?
So I personally believe that whichever science is there has been tested and peer reviewed must be used. And there is no reason why we shouldn't. I think the problem is that we haven't actually put these kind of solutions, quite a lot of them have been put to peer review. To the peer reviews, we haven't done a robust sort of clinical trials on these, and I don't understand why.
Yeah, I know there's been attempts with ashwagandha and a couple of other things.
There has been attempts with coconut oil. There has been attempts with turmeric.
Yes.
And these are now well approved, FDA approved, and we know that turmeric has got antibiotic properties. Simple salt has got antiseptic properties. And we've been using it. In fact, I have been using it as a form of treatment. So all of this is well researched. It works, and it gives the kind of a treatment or cure that it is supposed to. But things that are not,
Yes,
my humble suggestion or request is that we are a country of 1.4 billion. What stops us from doing research? What stops us from actually coming together and looking at these things and saying, let's make sure that we look into this and find out really how it can actually change? Because that will change lives of people. And I think, the need is now for these things.
There's also now a booming industry of supplements.
Oh,
This gummy, that gummy, and how perimenopausal women have to be taking XYZ. And I know that given the fact that we are now so diet conscious, and perhaps there are some supplements that actually are necessary, how do we tell the difference? So, should supplements be prescribed by a doctor?
Yes. So, English is a very funny language.
You keep saying.
Let's come to what do you mean by supplement? एक simple layman के term में supplement का क्या मतलब होता है? Complement और supplement हम सब ने पढ़ा है, ठीक है? तो उसको उसी तरह treat करना है. The answer lies there in the word itself. So, do you have a deficiency of a particular, mineral or a vitamin or a salt in the body? Because a deficient mineral, salt, or a vitamin will cause problems. There are essential requirements at a cellular level, mitochondrial level, of essential vitamins, trace elements, and all the salts. इनमें imbalance जब होता है, जो hemostasis हम कहते हैं, वो जब बिगड़ता है तो problems होती है. और वो प्रॉब्लम्स आपको मसल्स में, एक्स एंड पेन्स में दिखाई देंगी, बोन्स के वीकनेसेस में दिखाई देंगी, आपके जनरल फटीग और इस सब में दिखाई देगी. तो जब भी हमें वो दिखाई देता है, वी शुड एक्चुअली supplement. The trouble is that I'm seeing a lot of people coming with hypervitaminosis. So
वो क्या होती है?
So hypervitaminosis is आपकी suppose आपको विटामिन B12 की डेफिशिएंसी है. आपने शुरू कर दिया लेना विटामिन B12 सप्लीमेंट विदाउट रियलाइजिंग दैट अब आपका लेवल नॉर्मल से 3 गुना 4 गुना ज़्यादा बढ़ गया है. And hypervitaminosis, both for A, B, and others, have been well studied as causes of cancers.
Thank you for introducing a whole new complication in our life now. Because I was under the impression that if you, that your body just discards whatever it does not need. It's not true.
ये जो है ना हम taking for granted the body को कर रहे हैं. I think वही behavior जो है जो problem है.
Okay.
So let's just step back. हमें उतना ही, मैंने कहा ना कि it all comes back to the same analogy, fuel. आपको उतना ही चाहिए जितनी आपकी बॉडी को जरूरत है, आवश्यकता है, उससे ज्यादा प्रॉब्लम क्रिएट करेगी, उससे कम भी.
तो ये जो आइडियाज है कि आप सेंट्रोमेट ले लो दिन की या सुपरडाइनेट ले लो, मल्टीविटामिन है, कवर्स एवरीथिंग. Women in peri-menopause, menopause have to take calcium, have to take iron because those resources are depleting. So how do you reconcile that with what you're seeing about?
Very simple. I'll go to what. So one of my other academic field is statistics. So in statistics, there is a very simple quote. You can't improve anything that you can't measure.
Okay.
यहाँ हम किसी चीज को इम्प्रूव करने की कोशिश कर रहे हैं बिना मेजर किए, और उसको इम्प्रूव किए जा रहे हैं साइकोलॉजिकली,
हाँ,
विदाउट मेजरिंग कि वो इम्प्रूवमेंट कितना है. So my suggestion is that begin with measuring. Okay. So get your entire, if you're worried about trace elements, you can get it all tested, right? So start with making sure that actually you have a deficiency or you have issues that requires those supplementation, and then supplement it only for the required time and interval that is required. A broad example would be कि if your body is deficient of vitamin B or others, a 3-month course of replacement gives enough store in your liver to last for a year.
Okay.
So उसके बाद आपको साल भर तक लेने की ज़रूरत नहीं है. And then you can test again and see, and in that time, you make your diet rich in that. You make your lifestyle rich in that so that you don't need those supplements. One of the examples is go out in the sun, you don't need vitamin D. Right? तो अगर आप अपना lifestyle initial supplement कर रहे हो, बाद में आपने lifestyle change कर लिया, then you will not need the supplement again. So measure, replace only if it is depleted, and then measure it again to see if you require. But in between, change your behavior, change your lifestyle.
All right, Dr. Thakur, thank you so much for spending time with me today.
Thank you.
It has been a brilliant conversation. I wish you very, very good luck in your stint in Mumbai.
Thank you. I'll need that.
Thank you.
Thank you very much.